second time since 2022, monkeypox has been classified as a global health emergency due to its swift spread across Africa and the potential risk of reaching other continents. On Wednesday, the World Health Organization raised its alert to the highest level for this viral disease, highlighting that Africa has reported over 14,000 cases and 524 deaths this year, surpassing the previous year's numbers. The WHO flagged it as a public health emergency of international concern, which is the highest warning level. WHO's emergency declaration on monkeypox, which is also known as MPOX, came a day after the Africa Centers for Disease Control and Prevention declared it a public health emergency on the continent. MPOX has now been detected in at least 13 African countries. So far, more than 96% of all cases and deaths are in a single country, which is Congo. The Global Health Agency said MPOX was recently identified for the first time in 4 East African countries, where all of those outbreaks were linked to epidemic in Congo. According to the World Health Organization Committee, the current upsurge of MPOX in parts of Africa, along with the spread of a new sexually transmissible strain of the virus, is an emergency not only for Africa but for the entire globe. WHO warned further imported cases of the new and more dangerous strain in Europe after Sweden announced the first such infection outside Africa. A person who sought care in Stockholm has been diagnosed with MPOX caused by the clade 1 variant. It is the first case caused by clade 1 to be diagnosed outside the African continent, clearly reflecting the spread of the virus. The WHO's European Regional Office in Copenhagen said that it was discussing with Sweden how best to manage the newly detected case. According to the global agency's statement, the confirmation of MPOX clade 1 in Sweden is a clear reflection of the interconnectedness of our world, and there are likely to be further imported cases of clade 1 in the European region over the coming days and weeks. WHO in fact advised that travel restrictions and border closures don't work and should be avoided. Now, in an alarming update, Pakistan has identified 3 patients with the MPOX virus. The infection was detected in these patients upon their arrival from UAE. Given the global situation, China has announced it will begin screening international arrivals displaying symptoms of MPOX. Chinese customs authorities stated that all aircrafts and vessels, including cargo and container ships, arriving from areas impacted by MPOX must follow 2 health processing protocols. In India, official sources from the Health Ministry indicate that the government is closely monitoring the situation and developing strategies to safeguard the country against the recent spread of the virus. The government is expected to make announcements soon regarding enhanced surveillance measures.